St. Louis area health officials, well, they've been seeing a rise in COVID cases all over our area. There were 332 COVID hospitalizations. That was in November of last year. And in January, this month, that had nearly doubled to 799 COVID hospitalizations. What that means is that the challenges of COVID is still with us. That is tonight's You Paid For It. Ainia Healthcare CEO Dr. Kendra Holmes has been in the COVID battle the entire time. First, she and her organization did the testing, then administered COVID vaccinations. They still provide the COVID vaccines at their locations to anyone who needs them. She keeps constant check on where we stand with COVID. How does Missouri stand insofar as COVID deaths are concerned?
Well, Elliot, the CDC publishes a weekly map tracking COVID-19 deaths. And as of the end of December, nationally, we were about 3%. Missouri, unfortunately, is at about 4.7%. So we're above the national average, and that puts us in the top 10 of the states with COVID-19 deaths.
Dr. Holmes says there are a lot of reasons that Missouri has so many COVID deaths, although she adds we are nowhere near where we were during the height of the COVID pandemic.
Well, unfortunately, Missouri is a state that has poor health outcomes. If you look at the rates of obesity, chronic disease, smoking, those are poor health indicators, which will lead to, unfortunately, increased risk of death due to COVID-19.
But she stresses many more people are surviving COVID than before the vaccine. Nonetheless, are we seeing an increase in COVID-19 cases in the St. Louis area?
Sure. So it's the respiratory season. It's the respiratory virus and flu season. So after the holidays, start Thanksgiving, we start to see that increase in RSV, flu, and COVID-19. Fortunately, we're not seeing the hospital systems being overwhelmed. They're able to meet that demand. And the major take home for me, and I think for everyone, should be that's because vaccination works.
One of the big challenges now is keeping track of the COVID cases. Health experts used to use things like the positivity to measure the number of new COVID cases during the worst of the crisis. Not now. So what is a positivity? We used to use that as a measure. What is it now compared to what it was before?
So because of the change in how we're testing for COVID-19, most people have in-home tests, and that's not being tracked. We don't really test the positivity rate. We don't follow the positivity rate. What the indicators generally are is hospital rates of hospitalization, rates of deaths. Those are the items that we will continue to track because, again, individuals may have COVID-19, they may test at home, but that information is not being reported to the health department.
Dr. Holmes says there is a silver lining.
We're getting back into our rhythm of flu season. And to me, that's actually a good thing. Then that proves that we really have persevered and we've gotten past the really hard part of COVID-19. So this is the new normal, right? We're going to see cases of flu. We're going to see cases of COVID-19, but we're able to adapt, and I think that's the important part. They're ready to be over COVID. They've had it long enough. When is it going to be gone for good? That's what folks are saying. Well, Elliot, you've been asking me that question it's going to be 4 years now, and I give you the same answer. It's not going anywhere. It's part of our life. Just like the common cold is part of our life. I'm sure people 100 years ago were saying that they were over the common cold, but it still perseveres. So this is here to stay.
And remarkable progress since the height of the COVID pandemic. While there were nearly 800 COVID hospitalizations in Missouri this month, in December 2020, there were about 2,100 COVID hospitalizations statewide, a vast difference. I'm going to stay on top of this issue that's been with us for some time now. After all, you paid for it.